Welcome to another video where we will simplify the approach to CT brain hemorrhage. I will also add 2 tips at the end of the lecture to help you avoid missing these subtle bleeds in the brain. In order to simplify this approach, I would like to answer 2 questions. How does intracranial hemorrhage look like on a CT? And how do we figure out what type of bleed this is? To answer the first question, let's look at the density of a hematoma. As you can see, the density will vary depending on the timing, but for majority of cases we will see a hematoma during the acute phase, which is roughly would give us 80-100 units or higher. To understand why the bleed will appear white, we have to look at the window settings used for CT brain. Some of you are probably familiar with the lung and bone windows where we can focus our study on specific structures. The same applies for the brain window. We can see certain structures that are within our window, but everything above our window will appear bright and everything below will appear dark. Now that we know why the bleed is bright, we need to look at the appearance. But first, we need to be familiar with recalcification seen in vast majority of cases. And this is considered a normal finding in most cases. These are calcifications in the choroid plexus bilaterally and the pineal gland, and together they will form a triangle. It's important not to confuse these with a hematoma. The appearance of the bleed will depend on the anatomic location, and we can divide these into 2 types, either extraaxial, that is outside the brain, and intraaxial, located within the brain. Extraaxial bleeds include epidural, subdural, and subarachnoidal hemorrhage. Intraaxial bleeds include intracerebral and contusion. The latter will be in the context of a trauma. Now let's look at our case again. We can see a left frontal biconcave bright hematoma pushing the adjacent brain away. So we know this is an extraaxial bleed. But how can we differentiate between those types? To understand the appearance of the bleed, we need to look at the space they occupy. Epidural bleeds are located outside the dura, as the name implies. For this reason, the bleed will not cross sutures and tend to form a lentiform shape, a shape that looks quite similar to an apple. Subdural bleeds are located within the dura but outside the arachnoidal matter. This bleed will tend to track along the brain and it will not cross into the sulci. They classically form a crescent shape, quite similar to a banana. Subarachnoidal bleeds are located within the subarachnoidal space and therefore they will go into the sulci. Now, with these principles in mind, let's have a look at a few cases. We can say that this bleed pushes the brain away and does not cross into the sulci. The form of this bleed is quite similar to an apple, so this is an epidural hematoma. Now let's have a look at another case. Here, as we go through the axial images, we can see a bit more subtle bright bleed that is located outside the brain as we see it pushing the adjacent brain away. On the coronal, we can see that this bleed does not go in the adjacent sulci, and this form fits quite well with a banana. This is a subdural hematoma. Now let's have a look at this case. Here we can see quite diffuse and massive hemorrhage bilaterally where it's spread throughout the sulci, but it's not located within the brain. This is a classical appearance of a subarachnoidal hemorrhage. These can be caused by a ruptured aneurysm or a trauma. In this case, we have a relatively small bleeding located within the left thalamus. This is an intracerebral bleed, and these can have multiple causes, either primary or secondary. In this case, we have an intracerebral hemorrhage with a classic location for hypertensive bleed. These can also be found in the pons and cerebellum, although not as common. Now, as promised, there are 2 tips that I recommend you always keep within your search pattern when you look at these images. First, always have a look at the falls and tentorium to look for a subtle subdural hematoma, as they can occasionally only be seen there. Even in our previous case, we can see a thick tentorium on the right side, which indicates a layer of blood sitting on top of it. Similar appearance can be seen within a localized subdural hematoma along the falls. Another important area to look is the occipital horn of the lateral ventricles. Due to the gravitational position of the patient laying down, this is an important area to keep within your search pattern, as this place is a sensitive location for a small hemorrhage. Now I hope this video has been helpful, and I hope you, as a student, will feel more comfortable the next time you will look at the CT brain. If you enjoyed this video, don't forget to like and subscribe. I hope I'll see you in the next video. Take care.